We'll begin this hour with this disturbing discovery by the World Health Organization that 51 new cases of circulating variant polio virus have been detected in Nigeria from January to August 13 this year. Out of the new cases discovered, the Northwest Zone accounts for 92%, spanning 15 local government areas. 47 of the cases are from the states in the Northwest Zone that are facing security challenges, a situation that has now become a major concern for all stakeholders in the health sector. This was disclosed by the WHO country representative in Nigeria, Dr. Walter Molombo, during a strategic meeting in Kaduna State, organized by the National Primary Healthcare Development Agency in collaboration with the Sultan Foundation for Traditional Leaders of Inaccessible Communities in the Northwest Zone. Let's talk more on the discovery of polio cases in Nigeria. I'm joined by consultant pediatrician from Obafemi Awolowo University Teaching Hospital, Ilefe, Professor John Okeniyi. Prof, thank you for joining us on the news this hour. Some 3 years ago, Nigeria was officially certified polio-free. What does this new discovery mean for that record? And what's the difference between the new variant and the wild polio we are used to?
Well, thank you, and thank you for inviting me. What we were certified for is absence of the wild strain of the polio virus. There are 3 wild circulating strains called 1, 2, and 3, so named. But these have been eradicated from our country since 2020, and they remain so. There is no circulation in wild virus. However, we have this circulating variant, which is for late-term vaccine-associated development, and it results from mutation of viruses from the vaccine, and then there are other factors that are involved in this mutation. Poor handling of vaccine storage, and then high level of population mobility. So these are some of the problems that are associated with vaccine mismanagement, and it's unfortunate that we have this, but it's nothing new and it's nothing alarming. In 2021 and 2022, there were 168 cases all through the year. So this is not strange, but with good surveillance as it is, we will detect these cases. We're looking for cases of acute flaccid paralysis, which is what polio causes, and the vaccine-derived circulating variants. So we're in order, and it shouldn't be a cause for alarm. Yes, it's not good news, but it is not a cause for alarm.
Will this new variant require a new mode of vaccination, different from what we had before?
No, not really. While this is coming from mutation from the vaccine itself, if we are able to improve vaccine coverage and deal with issues of population mobility, things from people being moved from where they stay to IDPs and insecurity, we will be able to get a high level of vaccine coverage. If we have vaccine coverage above 70 and certainly 90% of target populations, there should not be an issue.
So this report says many of the cases are from states in the Northwest Zone battling security challenges. What's the correlation?
Correlation is with insecurity, you will ultimately have low vaccine coverage. Why? People are displaced from their homes, health workers are not able to access them, resources are diverted from routine immunization. There will be challenges ultimately to routine immunization programs, and there will be vaccine mismanagement. There will be problems of vaccine storage. So when cold chain is, vaccines are meant to be stored at very cold temperatures. So when cold chains are broken, then the possibility of mutations may occur. So the problems are interlinked: insecurity and poor vaccine coverage, and this emergence and circulation of circulating polio viruses. Yes, they are linked.
Briefly, Prof, what's the top of the list of what we should be doing in response to this discovery?
We should continue our surveillance to know where the problems are and to be able to have immediate response to any new places where we have cases of acute flaccid paralysis. Polio remains a notifiable disease. So anywhere we find any one child or person with features of acute flaccid paralysis, health workers must notify. And the process of notification, we all know. Then the particular persons from the state ministries will be able to target that index case and see if indeed it is polio. Majority of cases of acute flaccid paralysis almost always turn out not to be polio, while the larger picture of addressing insecurity is addressed by the relevant authorities.
Consultant pediatrician with Obafemi Awolowo University Teaching Hospital, Ile-Ife, Professor John Okeniyi. Thank you for talking to us.
Thank you very much, and do have a nice weekend.